Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, it is my very, very great pleasure to welcome Melissa Mills. Melissa is an accomplished nurse whose expertise spans leadership, education, curriculum development, and operational management. And her clinical experience is rooted in long-term care, home care, and the hospice settings. Currently, she serves as the head of content for cinematic health education, and she's executive director for the Commission for Long-Term Reimbursement. She also sits on the board of Nurses in Charge. So, welcome, Melissa.
Thank you. Thank you. I'm excited to be here and chat with you today.
It is my absolute pleasure. So, firstly, why your nurse?
So I am a nurse because, growing up, my grandparents were in and out of the hospital. And so I started to see what nurses do.
Mm,
And then when I was in seventh grade, my grandfather died, but while he had cancer. And so at the end of his life, he had a hospice nurse who would come to the home and spend time with him, my grandmother. My parents, myself, and I just started to see this compassion and care that she gave. And that really is what inspired me to be like, I think I want to be a nurse. I really think that's what I want to do. So it was definitely seeing that true heart of nursing modeled for me through her.
that nurse must have been a fantastic model because not only did you go into nursing, you went into the areas of nursing where
Yeah,
she was instrumental. So, I
yeah.
mean, awesome, awesome,
Yeah.
awesome.
Yeah. I think when you see a nurse who, comes in, especially at the end of life, when there's pain, there's symptom management issues, and you see her using not only like her nursing knowledge, but just that care and compassion, it was really moving. And especially to a teenager, right? Like that's pretty powerful.
That is pretty powerful, yes,
Yeah.
especially to a teenager, because as a teenager, you want to just kind of detach yourself from all of this
Right.
suffering and pain and whatever.
Yeah.
So that's huge. It's
Yeah.
huge. So you saw this fantastic nurse and she influenced you and you wanted to be like her. When you got into it though, was it what you thought?
Yes and no, right? I think the patient care side is exactly what I thought it was going to be.
Mhm.
Spending that time with patients, investing in them and their health, doing education, the hands on care. The cultural parts of nursing were not, right? Like the the I've been a nurse for 26 years, and so definitely there was this, nurses eat their young kind of mentality, and so dealing with that, and just the hardships that you see and what that takes, out of you. That
Mhm.
part I wouldn't say that I was truly prepared for.
Mhm. Mhm. Yep. So I am not even going to bother to ask you where you worked because clearly you said where you worked in long-term care,
Yeah,
hospice, home care. But
yeah,
we talked about your expertise, you talked about your leadership, education, curriculum development, operational
yeah.
management, and you're talking about you know, the executive director for nurse reimbursement, nurses in charge, that kind of thing. What exactly do you want to see change in nursing?
Yeah, so definitely with the Commission for Nurse Reimbursement, what we really want to see changed is that nursing skills are reimbursed, so that we are not just part of the room rate or overhead, But that, if a nurse goes in and we use our advanced clinical skills and problem solving skills, that hospital is then, or care facility, because even long-term care could also benefit from this. But that care facility is able to bill for those skills, and that money is then used to staff nurses the way they should be staffed, right? So that, because right now, if a hospital wants to make more money and they're looking at the nursing department, the only way they can do that is to decrease the number of nurses that you have, increase the number of patients per nurse, which we know negatively impacts patient outcomes. And so I think to make nursing sustainable and stable, we have to really engage in that. And then with nurses in charge, I think, we're looking more at how do you help nurses with self-care, with burnout? How do you help to empower nurses to take care of themselves? Because we know, like the old adage, you can't pour from an empty cup, right? It's so true. And nursing care, I worked in the NICU as a new nurse, and it drains you. You
Mhm.
can only go in and care for so many infants that are acutely ill. Some of them don't make it. You can only do that for so long before it really starts to take a toll on your heart and your soul, right? And we've got to help nurses know how to care for themselves.
Okay. So since you brought up self-care and burnout and all of this, let's
Yeah.
skip right over and ask you then, what do you do for self-care?
Yeah, so I do little things throughout my day that really helps, right? Like I listen to affirmations as soon as I wake up. First thing that I do, I listen to a YouTube, same thing every day, and I repeat the same group of affirmations. I've been doing that for a while now, and it really just helps to set your mindset for the day. So like, okay, I'm ready and empowered to take on the day. I like to get outside and walk. Especially when I'm doing curriculum, you got to get away from the computer sometimes and just let your brain expand and think and process things. And just really doing those things that fulfill me, right? It's not, for me, self-care isn't about necessarily like, oh, I go and I get my nails done. It's about doing those things that really makes my heart and soul feel peaceful.
Yeah, I get that. I get that. I get that. And that's pretty. You talked about being outside, and
Yeah,
for me, if I'm outside, I'm good. It doesn't.
yeah,
Nothing has to be happening. I'm outside, and
right. Yeah,
that's good.
yeah, me too. I've been working on grounding too. So I'll put my feet in the ground and, feel that dirt like we talked a little
Yeah,
bit before we started
yeah.
recording about, working in gardens. I'm not a gardener, but I do see the value of connecting with the earth, right?
Yeah. And it's very the thing is that if you're outside, not only are you just outside and kind of away from things, but you become aware of the other life forms that inhabit the earth. You know,
Yes.
the birds and the
Yeah.
squirrels and even the snails are,
Yeah.
um become so much more valuable to you.
Yeah.
So
Absolutely.
you're in education though.
Hmm.
You first of all, explain this to me. You're
Yeah.
the head of content for cinematic health education. So talk to us about what exactly is cinematic health education.
Yeah. So Cinematic Health Education is a company that creates content for nursing assistants for their initial content when they're being trained. So we create the content, and the reason that the company is called Cinematic Health is because we use a narrative based or a story based concept in our learning. So we actually have a full motion picture that is broken up into episodes, and it is kind of the anchor content throughout the nurse aide program, because we know that, especially in that caregiver space, nurse aides, home health aides, that's the space that we're in. We know that in that caregiver space, they don't always understand what the job entails and how challenging it can be, right? And it's hard to explain that to someone. If you say, oh, you're going to have 15 residents to care for, it's very hard to understand what that looks like. But if you can see that in a movie and you can connect with those characters, you start to understand some of those challenges, barriers, problems, as well as the heartwarming connections, relationships that you have with patients. And so that's how we go about. It's really a very novel way of teaching people to understand just what the role entails.
And it sounds like it prepares people more effectively for the job.
Yeah, absolutely. Because they have that real world perspective
Yeah.
before they hit the real world, right? Like
Yeah.
I remember seeing the nurse aide in that movie, struggle with a patient who died, struggle with the first time they had to change an incontinent patient, and the odors and the things that we go through, right? Like we all understand that, but how do you teach that to someone? But if they can see it and they feel that in that movie, then they really start to understand. So that is how we do it at Cinematic. And as the head of content, when I came in, the movies were already created. So unfortunately, I didn't get to help with that. But the content that is state required for nurse aides and home health aides, I make sure that that content is based in best practice, that it is according to rules and regulations of each state, right? There's federal regulations, there's state regulations. So I want to make sure that all of that content is really going to get them through the program from an academic perspective, a real world perspective, but they also understand what their scope of practice is, and the fact that they're a mandated reporter for abuse, neglect, and exploitation. Those kind of things are in there too.
Awesome, awesome, awesome. And I'm glad you mentioned about being state specific. I was actually going to ask you, how broad this is across the states. But there you go.
Yeah. So and that's the challenge with education at the CNA level, because
Mhm.
there is a federal mandate that they have to have 75 hours of training, but yet the states then get to kind of, decide what is in that content. And so every single state has a different expectation.
Yeah,
And so it has to be very state specific. Some of the content obviously works for all states, but then some of it has to be state specific.
yeah. So you're in education. Many some people start out as CNAs, go on to become nurses, or go on to, expand their roles, however they do within
Right.
within healthcare. What advice do you give them?
Yeah. So I was a CNA in nursing school, and then, moved into being a nurse, and went back and got my master's in healthcare administration. I think the advice for whether it's a CNA or a new nurse is probably to be true to yourself. Find that niche or specialty that really fulfills you and makes you feel useful and appreciated, and know that it's going to be challenging. Healthcare, we're just in a really challenging time with healthcare. It is going to be challenging, but it will be worth it. One of the things that I really like about nursing is that you can reinvent yourself 100 times over if you want to, right? Like you don't have to be at the bedside your entire career, and you are still a nurse. You're not just a nurse, you are a nurse, and you have skills and knowledge that other people and companies need.
Yeah. Yeah. That is a fact. And I think one of the I don't know if it's one of the reasons, but one of the things that we don't recognize as nurses, as you mentioned those skills and you mentioned that knowledge, and it becomes part of our everyday life. And somehow we seem to think that everybody knows this.
Right.
Everybody doesn't know this.
Yeah, absolutely. I know I was talking to somebody this morning about she was wanting to go into writing, and I said, you have to remember that you're not just a writer, you're a nurse writer. You have so much more skills because we can all, if you read a blog and it doesn't make sense, the first thing you think is, it wasn't a nurse that wrote
This
this.
wasn't.
So, really embracing the fact that you have knowledge that not everyone knows. Yeah.
Yeah. We kind of take it for granted.
Yeah.
What would you say is the most essential quality of a nurse? If you had to say it in one word, what would that word be?
Flexibility.
Yeah.
I think, a lot of times I think a lot of people kind of migrate to compassion and empathy, and we absolutely need that. But I think flexibility, because no day is ever the same. No patient is ever the same. Just because a patient has the same diagnoses as the one in the next room, it's going to be a world different between them. And so being able to be flexible and agile and able to just jump in where you're needed, I think is such a integral part of being a nurse.
Yeah. And it's really huge.
Yeah.
Because we do it so quickly
Mm-hmm.
and often so seamlessly that we don't
Yeah.
even we ourselves, I think, don't even realize how much we have pivoted 180 degrees in 30
Yeah.
seconds.
Yeah. Yeah. It's funny because when I was in the NICU, and I think I had been a nurse maybe a year or so when I took that role. And the first time you go through a code, you're like, oh, nervous. And then, 6 months, 9 months down the road, I remember the first time that I had a baby that had coded, and I was like, cool and calm. And I knew what to do, and I knew how to take care of things. And I was flexible and able to just navigate through that situation. And even afterwards, I remember, and this was probably in 2000 when this happened. So 20 plus years later, I still remember when the charge nurse came up to me and said, wow, you were totally in tune with what needed to happen. You just did it. You didn't double guess yourself. And it's that flexibility and that critical thinking that just allows us to do that, right?
Yeah. That in those situations and that knowledge and experience kind of comes over you like a cloak, and you just kind of
Yeah. Yeah.
move along with it.
Yeah, for
Yeah.
sure.
So flexibility is very definitely a good one. So you have done a lot. From my
Mm-hmm.
perspective, you've done a lot. You continue to do a lot. So what would you
Mm-hmm.
say is your greatest achievement so far?
I think probably my greatest achievement, I would think it's just following my skills, right? It is, when I was in at the bedside, I really started to realize that it's hard to affect change one patient at a time. And so that was what motivated me to go into leadership, and ultimately I've always been a word nerd, always loved to write, ultimately what led me into education. And I think my greatest accomplishment is it's not a tangible thing. It's not an award. It's
Mm-hmm.
just recognizing my true gifts, um, and then aligning my nursing practice with those. And then that has led me into roles that really have allowed me to succeed.
Awesome. I love it. I love it. And that's kind of like one of the reasons that I ask that question, because
Yeah.
I feel like often we get so caught up in all that we do,
Mhm.
that we don't take time to take stock
Yeah.
of the fact that, yeah, so it's as you said, it's not always the awards and stuff that we achieve, but it's the satisfaction of it all, the
Yes.
coalescing of everything that we have done that is huge. Or for
Yeah,
me, I see
absolutely.
it's a huge thing.
Yeah. Yeah,
Anyway,
me too.
yeah. So, um, I was going to ask you about innovative nursing and instructional design, but I think you just talked about that when you talked about cinematic health education.
Yeah, a
Yeah.
little bit. I think, instructional design really is the concepts of how an adult learns, right? And so we want to create content. I want to create as a curriculum developer, I want to create content that really meets that person where they are at that moment, gives them the information that they need, but is structured in a way that is engaging, that keeps their attention. We know that, especially with all the micro learning and different things that have come out, to really make sure that they're getting exactly what they need at that right time. And so that's what instructional design is really thinking about what you want them to walk away with.
Yeah, 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 yeah. And that's a big thing, because as you were talking about that and about cinematic health, and what came across to me is that digitally you're able to transfer emotion
Yeah.
to these learners. And that's big.
Yeah. Yeah. Absolutely. Absolutely. Because that's what, again, like that's the soft skills that they
Yeah,
need. That's the compassion, the care, the active listening, those sort of things that they need, which, we can teach someone the steps, right?
yeah,
You perform pericare in these 20 steps, but there's not a step by step guide to how to be compassionate, to how to be empathetic, to how to listen actively. Those things have to be shown.
yeah, yeah, yeah. Exactly,
Yeah.
exactly. And in the 21st century, you've come with a way to show it
Yeah.
impactfully. That is
Yeah.
huge.
Yeah,
That is huge.
absolutely. It really is, especially with, the population of caregivers tends to be, sometimes it's people who are English as a second language learners. So, again, seeing that emotion and being able to put that together is just huge to really get them to be able to excel at the job.
Absolutely fantastic.
Yeah.
Fantastic. Melissa, before we go, is there any gem you'd like to leave us with?
Oh gosh. Um, yeah, I think nursing is in a really interesting time. The pandemic was hard, but it also really shined a light on the problems and gave nursing a voice. I think it's the first time in my 26 years that I feel like there's starting to be a collective voice, nursing voice, where we're all starting to say the same things, to talk about the same things, to feel like it's time for change to move in a specific way. And so I would say that the gem or the nugget is to look for those people that are doing the work and get yourself involved in that work. There's so much advocacy going on, policy work going on to change the future of nursing, the sustainability of nursing. So don't feel like you're by yourself. Look for those people. They're out there and they want more people to come alongside them and work together. So just keep looking for those people, and looking for ways to improve nursing.
Huge, huge, huge. And I think that, as you mentioned, that there are people out there looking for people to come alongside them. I see,
Yes.
as I speak to nurses, that nurses are no longer intimidated or
Yeah.
feeling that they don't have a right to be out there. We've
Yeah.
changed that, and that
Yeah.
attitude is coming out. That
Yeah.
we're
And
here and we're gonna go for what we want.
yeah, and it's huge, and I think it's also a generational thing, right? Like these newer nurses, we've as mothers, as women, we have empowered our children to be like, nope, this isn't good for me.
Yes,
And those are the nurses who are now practicing, and they're willing to step up and voice those concerns where maybe we weren't as empowered to do that, and they're doing that, and that's huge, and I commend all of those nurses for doing that and speaking out.
yes, I do too. I do too. And this is like we're talking here today, like at the just a week past Nurses Week. So more power to you, nurses. Melissa,
Yes,
thank you so very, very, very much for doing this. I truly
thank
appreciate
you.
it. I truly
Yeah,
appreciate it. And friends and followers, this is Dale saying thank you so much for joining us today on this podcast. Hope to see you next time as we showcase nurses from around the world to the world, one conversation at a time. Thank you so much.
thank you.